one of the nuances of cabazitaxel was that it was approved as 25 milligrams per meter squared, and it was recommended that it be given with GCSF. And that scared a lot of people away. Early on in the very first trial, there were 10 deaths from cabazitaxel versus none with mitoxantrone. And so it was perceived of as a difficult, toxic drug. And so then Sanofi did a randomized trial of 20 milligram per meter squared versus 25. And GCSF could be used as needed. Well, that trial showed absolute equivalence, that 20 milligrams per meter squared with or without GCSF was equally effective and frankly less toxic. There was very little alopecia, very little neuropathy. The biggest side effect turns out to be hemorrhagic cystitis and intermittent diarrhea. Well, we can fix diarrhea. Pretty hard to fix hemorrhagic cystitis. So that randomized phase 3 large trial, and then the CARD trial, when you juxtapose them, you realize that this is the standard of care drug for a patient who has already had docetaxel and has had either ABI or Enza. And therefore, using the alternative drug, if you had ABI, then you try Enza, that's not a very fruitful experience and not very useful. Now, that's still done because there's this fear of chemotherapy. And the fear of chemotherapy is particularly amplified with cabazitaxel because of its history of neutropenic fevers. You can't give it to the old people, et cetera, et cetera. So the current landscape is beginning to see an improvement in sort of perception of cabazitaxel.